to On One Radio, the talk show podcast station, bringing you the current events and issues. All information and resources are based on the opinions of the host unless otherwise noted. This podcast may contain some quotations, images, and/or excerpts from copyright material. These uses fall well within the copyright doctrine of fair use. This is the News Report, and I am your host, Tony. Welcome to all my new listeners and all of my day ones. Welcome. This is your news report brought to you by Let's Talk, sponsored by On One Radio, the talk show podcast station. Okay, so there's definitely a lot in the news as far as headlines, but this one here grabbed my attention, and I really needed to share this with you all. I want to get a feel of what you all think and feel about this one. Emails show former Trump health appointee advocated herd immunity strategy. What is herd? What is herd immunity? And what's going on with this? Now, COVID-19 is not a well-kept secret. It's out there. We're losing people behind it. And we're just getting a vaccine and everything. Well, some vaccines for it. And there's a lot of tension behind this. Now, the headlines read, a former senior health and human services advisor advocated this summer to let young and middle-aged Americans become infected with COVID-19 in order to develop herd immunity. Now, that's according to emails released on Wednesday by the House Committee overseeing the federal government's coronavirus response. So why does this matter? Well, without a vaccine, achieving herd immunity in which widespread outbreaks are prevented because enough people in a community are immune to a disease would result in widespread facilities and likely overwhelm health systems. Now, Politico first reported on the documents released by House Majority Whip Jim Clyburn, who chairs the Select Subcommittee on the Coronavirus Crisis. Now, Paul Alexander was the former advisor to HHS Assistant Public Affairs Secretary Michael Caputo, who took a leave of absence after accusing the CDC scientists of gathering a resistance unit against President Trump. So what are they really saying? Well, it was said, and I'll read as follows. My view, we open up fully and describe below. Protect the vulnerable, make sensible decisions, and allow the nation to develop antibodies. Alexander wrote in a July 4th email to multiple HHS spokespeople, including his former boss, Michael Caputo. Infants, kids, teens, young people, and young adults, as well as middle-aged with no conditions, etc., have zero to little risk. So we use them to develop herd. We want them infected and recovered with antibodies, he added. In a July 24th email to FDA Commissioner Stephen Hahn, Caputo and 8 other officials, Alexander wrote, it may be that it will be best if we open up and flood the zone and let the kids and young folk get infected if we acutely lock down the elderly and at-risk folk, but use the strong and well in the society to get infected and get to that 25%. Maybe as we wait for a vaccine and therapeutics, we may be able to get 25% antibodies ourselves by natural immunity, natural exposure, Alexander added. This can't be discounted. We have to think outside the box. In a July 27th email to CDC Director Robert Redfield, Alexander said the country essentially took off the battlefield the most potent weapon we had. Younger, healthy people, children, teens, young people who we need to fastly, sick, infect themselves, spread it around, develop immunity, and help stop the spread. So what's the big picture? Achieving herd immunity through mass infection of non-vulnerable people while protecting the vulnerable isn't possible without offering protections that the U.S. has never attempted. For example, nursing home cases have moved in tandem with the total number of cases, even though we've known for months that nursing homes are at risk as it gets. HHS Secretary Alex Azar and other Trump officials have insisted that herd immunity was never the administration's strategy, though the president suggested in September that the virus would disappear when people develop a herd mentality. Now, it's worth noting, Alexander also frequently attacks scientists like Anthony Fauci, accusing them of muddling public health messaging and trying to destroy the nation and people's lives just to make the president look bad. The other side, an HHS spokesperson said in a statement to Politico that Alexander's demands absolutely did not shape the agency's strategy. Dr. Paul Alexander previously served as a temporary senior policy advisor to the Assistant Secretary for Public Affairs and is no longer employed at the department, the spokesperson stated. So, what do you all think of this? I mean, seriously, herd immunity? So let all the healthy people get sick, basically, and recover, and they would have developed antibodies. So then how would they use those antibodies? So would they go back and harvest those antibodies to cure other people? This is extreme. That someone in our government to actually conceive this idea. Oh, just to let them get sick and let the body just naturally, do what it does. And, well, they don't know. They didn't know what this would do. If you let all the relatively healthy people get sick and, well, they don't recover and they don't produce antibodies, and then you've essentially did a mass depopulation. Actually, it was almost as if this guy was suggesting an open experiment on the nation. I don't know about you, but that is very unsettling. Like, why would you want to risk the nation like that? And I mean, this is something that has killed so many people already. So it has a mass depopulation feel to it to me. Y'all definitely let me know what you think about this, because this sort of thing should not be taking place. Now, I get the fact that in a situation like this that they have really no information per se on the situation, and this is not something that has been dealt with before. So there are so many unknowns. So you do in fact have to bounce ideas off of each other in the department to come up with some sort of solutions, or even attempt to come up with solutions. But something like this goes way too far. And for them to feel that this would work and bash the head of the CDC for trying to help protect people, it doesn't sit well. It does not feel right. I mean, again, this guy, he's sending these emails and he's basically saying we want them to become infected. How does that feel to you to hear that? What do you think? I know it's out there in the news. If you've heard of it, then you understand what I'm talking about. If you have not, this is news to you. And this is some awareness, because who we elect for these positions, elect and choose others to represent and speak for us and to stand up for us on a grand scale. And we don't need people who are willing to put us at risk. Like this was a huge risk. It's still a huge risk. Even with us getting the vaccines, there are still unknowns. Because this is all new. So there are still so many unknowns. So automatically there's going to be a certain amount of experimentation on this, because we were not prepared for this. Our government was not prepared for anything like this. So we don't need extreme experimentation. We just don't need that. Like I said, there's going to be a certain amount of experimentation to find out what works and what will help. But to throw our babies and all our youth and our young working adults, to throw them out there under the bus like that, that's not cool by any means or any standard. It's not cool. And we wonder why the U.S. is in trouble constantly for a lot of things. It is the stinky thinking of some who represent us that puts us all in grave danger. Let's just be honest about it, because that's grave danger. So did you all know about this herd immunity? How do you feel about herd immunity? If you were in the CDC or even the HHS hot seat on this, and it was up to you to make decisions, what decisions would you make in a situation like this? I've thought of this myself. What would I do? What would I say? How would I react? And it's kind of hard to say. But I know I would not throw all our youth under the bus. Because to me that feels like a mass depopulation sort of deal. I don't want to, there's no way I could, in good conscience, I could not risk people's lives like that. I could not risk people's lives. That's a huge scale risk. It's an extreme risk. So I would not have thought of that. Herd immunity. No. Because there are too many unknowns. It's not safe. I would have probably taken majority of the same steps that Dr. Fauci did, as far as making the public aware and what they can do to try to protect themselves. Of course, try to keep them as calm and relaxed and not panicked as possible, but telling them the truth about the situation. The social distancing, of course, so, washing their hands. I probably wouldn't have said 6 feet. I probably would have said maybe 10 feet or more. But it would be along those lines of public safety. I'm not going to risk public safety and put everyone's lives in jeopardy on a grand scale experiment. I just would not do that. COVID-19 has been a bad mamma jamma, and herd immunity would not have been something that I would have chosen or gone along with or even agreed to. It just would not have crossed my mind on, no. So how do you guys feel? If you're following me on any of my social media, Majority of my social media, the name there is Tony on One, as well as YouTube. Like, follow, share. And if you do follow me on social media, you will see all the reports that I do. I share them on my social media so that you can read them for yourself and, and think about them. So I welcome your feedback. You're more than welcome. Let me know how you feel about this. If you have any information, feel free to share with me. And if you'd like to come on the show and discuss or talk about any of these topics, you can email me on oneradiotalk@gmail.com. Place it to the attention of news reports. And just let me know you have something you would like to talk about. And we'll get that going and get you situated and let's talk. So until next time, protect yourselves. Let's all continue to use common sense because it seems that we're living in the age of experimentation, free experimentation without the permission from the nation, or should I say we the people. So be careful, be aware, and let's try to use more common sense with everything that we have going on, especially when it comes to public health and safety. Continue to wear your mask, follow a strict as possible protocol to keep yourself as well as your family and friends and loved ones and coworkers well. Have a wonderful day. You have been listening to On One Radio, the talk show podcast station, bringing you the current events and issues. Thank you for taking the time to listen to my news reports. I wish you the best and have a wonderful day and night.